want you to stop eating these 5 harmful foods immediately if you have kidney disease. The diet is so important in managing your kidney disease, and there are certain foods that you eat that can be harmful to your kidneys, and they can worsen the progression and lead you to dialysis. The thing to remember is this: depending on your level of kidney function, foods that are harmful to one person with kidney disease may not be harmful to you. So be sure that you consult your physician before making any dietary changes. Number 4, processed and packaged foods. Please stop eating processed and packaged foods immediately if you have kidney disease. And you know the foods that are processed. You know the foods that are packaged. If you go into the grocery store, here's how you think about it. The foods that are kind of on the perimeter, on the outside, tend to be the healthier, fresher foods, right? But the foods that are in the center, in the middle of the aisle, that don't need the refrigeration are the processed foods. And they can be loaded with preservatives that are bad for your kidneys. One, phosphorus, specifically inorganic phosphorus, is something that can be found in processed or prepackaged foods. And if you have kidney disease, it's really not great for you because you need normal kidney function to help you to process or eliminate your phosphorus normally. If your phosphorus levels become too elevated from eating a lot of these processed foods, then it can cause some serious problems. It can cause you to have an elevated PTH level or a hyperparathyroidism, which can lead to you having weak bones and increase your risk for bone fractures. And if you have really advanced kidney disease, then having this preservative can ultimately lead to you having a disease like calciphylaxis. The other thing with these processed or prepackaged foods is that they tend to have a lot of salt, a lot of sodium. And we know that having a high salt diet can lead to hypertension, which is the second leading cause of people going on dialysis. A lot of processed foods are also loaded with added sugar. It's a problem. Make sure you read the labels when you are looking at the packages of foods. Remember that the ingredients that are listed first are in the highest amounts in the food. And so if you're seeing a lot of words that you can't even pronounce and a lot of preservatives, then it's probably not the healthiest food for you. Number 5, sugary and carbonated drinks. Please stop eating sugary and carbonated drinks immediately if you have kidney disease. You already know. When you are drinking sodas, they are loaded with added sugar. Just one 20-ounce bottle of a soda can literally have like 65 grams of sugar. And just to put it in perspective, it's recommended that the average lady eat no more than 25 grams of sugar a day. The average man no more than 36 grams of sugar a day. But even if you're only drinking like a 10-ounce soda, it can have like 42 grams of sugar. So this is no bueno. It's just not good. Mainly because when you're eating sugar, it can increase your risk for diabetes. And diabetes is the number 1 cause of kidney disease. So if you already have kidney disease and you're running around here drinking up all these sugary drinks, well, then you can certainly hasten the progression of your kidney disease and you can increase your chances of going on dialysis faster. Don't do it. The other thing is not just carbonated drinks. Other sugary drinks, like some of these delicious coffees that are loaded with sugar, that can be a problem because when you drink these drinks that are full of sugar, it's like empty calories. You drink them and they're loaded with calories, but they don't fill you up. And so you drink the sugar, you get a really high insulin surge that causes your blood sugar to drop. And so guess what? You're hungry. So you're drinking a lot of calories and then you go behind it and you're eating a lot of calories. So this can not only lead to diabetes, which of course can worsen your kidney disease, but it can also cause you to gain weight. And if you gain fat, especially belly fat, and you become a person who's living with obesity, then that also can worsen your kidney disease. So you want to stop drinking sugary and carbonated beverages immediately if you have kidney disease. So what are the alternatives? Well, you know, water. You want to drink a healthy amount of water. And make sure you consult with your physician because depending on your level of kidney disease, the amount of water you drink may differ. For example, if you're in the early stages of kidney disease, then you may be drinking 2 or 3 liters of water at your doctor's recommendation. But if you have advanced kidney disease and you're not making much urine, then you may need a fluid restriction. Also, if you have other diseases like chronic lung disease or congestive heart failure, you may be under a fluid restriction. Consult with your physician. But in general, water is something that's no calories, and that would be really the best replacement for your sugary carbonated beverages. The other thing is the water doesn't have to be boring. You can spice it up. You can put lemons in it. You can put strawberries in it. It can be really fancy. I don't care how you drink your water. Just get it in and make sure that you stop drinking sugary sodas and other sugary drinks immediately if you have kidney disease. Be sure to watch my video on what added sugar does to your body after you finish watching this video. Again, if you have kidney disease, what's harmful to one kidney patient may not be harmful to you, so always consult your physician and dietitian before making dietary changes.